meeting is now going live, so you're being recorded live on YouTube. Over to you, Steve. Thanks.
Thank you, and good morning, everyone. I apologise for starting the meeting a little late, but welcome to everyone who's attending the meeting or watching via YouTube. As I say, this is a special meeting of the Health and Wellbeing Board to look specifically at the COVID implications for Knowsley, and I'll come back to that shortly. But there's a few housekeeping things I'd like to cover off at the start of the meeting, if that's okay. As I say, we are quorate, so we can hold the meeting. And I'd also remind people, colleagues in the board, to keep the microphones muted unless you're invited to speak, and please have your mobile phones turned to silent so that we can hold the meeting properly. To assist with the flow of the meeting as well, can I ask members to raise their electronic hand, and I'll keep sight of those hands being raised. And at that point, once they've indicated they wish to speak, I'll bring them in at the appropriate time. So unmute your microphone when invited to speak, and then put it back onto mute afterwards, clearly to help the running of the meeting. And also to ensure you turn your camera on and face the camera whilst you're speaking, so that we can get a proper view and contribution from everybody. And finally, again, just to remind participants that the meeting is being live streamed on YouTube, and just to again reiterate that members should refrain from straying into business that's private or confidential in any way. So at that point, I'd like to thank everyone, and moving on to apologies. Keith, are there any apologies for the meeting?
Yeah, thanks, Chair. We've received apologies from Tiffany Henry, Audrey Williamson, Anthony Leon, and Andrea Cooper. Paul Aginski is in attendance for Andrea Cooper today.
Okay, thanks very much for that, Keith. We move on to the formal business then, and item one is the purpose of the meeting. And I think this is key really, because again, I'd like to welcome everyone, and I appreciate it's such an immensely busy and complex period that everyone's working through at this time, and I'm really grateful for everyone to take time to come to this meeting this morning and contribute to this valuable discussion that we're going to have. The meeting is focused on the Knowsley response to COVID, and I can't think of a more appropriate time for the meeting to be held actually and have the discussions that we're having this morning in the context of our role as the Health and Wellbeing Board for Knowsley. So that is right and proper at this time that we can discuss the response and the next steps through our response to the pandemic across Knowsley. And again, I'm very, very grateful for colleagues to take the time away from dealing with the day-to-day issues that are presented for all colleagues to take time today to come to this meeting. So thanks very much for that. I'm sure we'll have a valuable discussion through a series of very important topics on the agenda today. And on that basis, I'd like to move on to the substantive items on the agenda, if that's okay. And agenda item 2, which is the current COVID-19 situation in Knowsley, and Sarah McNulty is going to present that item to us. Over to you, Sarah.
Hi, I'm just going to pull up this presentation with me. She says as she's staring into. Everyone see that?
It's not full screen, Sarah.
Okay.
That's great. Thank you. Yeah.
Yeah. Okay. Okay. Sorry. Yeah. So I'll try and work through the technology. Okay. So I'm going to do a very, very brief overview of the situation, past and present, for COVID-19, just to give everyone a bit of a context. I am sure you are more than familiar with what COVID-19 is. So it's a brand new virus that humankind have never met before, which offers its own challenges to us in that because we've never met it before, that there is no natural immunity within our population, and therefore, because it's highly infectious, it has the ability to transmit wide, rapidly, and create, as you've seen, an enormous amount of problems. It's the coronavirus. Those sorts of viruses range in severity from common colds to really severe things like SARS and MERS we've met before, or the world has met before. One of the problems we face with this coronavirus is that actually it gives us a really, really broad symptom spectrum. So some people who come into contact with it won't even show symptoms. Some of them may be able to pass it on but not show symptoms, whereas others much more unfortunate and will end up with really severe respiratory diseases, but also other multi-system disorders as well. And as you know, and as has been reported, actually, some people will die from this. So it's really, really tricky. We know that you're more likely to suffer those severe complications if you're of older age, and actually there's a growing amount of evidence, and we've seen a report that's come out this week that there are certain ethnicities that are more vulnerable as well. So just to give you that background, so I'm just going to go through really briefly some of the story around it. So on Merseyside, we were actually hit quite hard by COVID-19. And actually our confirmed cases and deaths are high in comparison to national figures and relative to many sub-regions. To the 1st of June, there'd been just over 5,000 tested and confirmed cases in Merseyside, and there's a real caveat around that in that, if you remember, we did not test everybody from the start. The people that got tested were those who were admitted to hospitals. So that 5,000 really represents the more severe end of the disease. And actually, we actively told people not to contact the health services if they had a mild disease that was manageable. So actually, we don't have a full picture of how many people to date have been affected by coronavirus. But I'll come on to where we are moving forward around that. So the Office for National Statistics weekly deaths data actually shows that there's been just over 1,400 COVID-19 deaths in Merseyside, and that's up to the 15th of May. There's a time lag in some of those. And again, as I'll come on in a few slides' time, it's widely acknowledged that will underreport the number of deaths that we've seen for a few reasons, mainly because people sometimes will die without being tested. So again, our data is not complete, but we do understand some of the problems with that. So in Knowsley, I've just put there, this is a graph showing our rates per 100,000, just so that we can compare with our other Liverpool City region populations. And this is just an epidemic curve that actually just shows us sort of from the middle of March to the start of June, our numbers of cases. And those is actually the red line. So as you can see, we within Merseyside, which was hit hard, we were hit quite hard as within within the region as well. Certainly from a rates of confirmed cases point of view. And you can see really, really clearly there that actually our cases really started to escalate in April and escalated quite significantly for a good month and then started to plateau. So we were hit quite hard with increasing numbers of cases for about a month. And the next slide just shows those numbers of cases by day. So you can really see a clear curve there as actually we were hit quite hard. And just to put it into some context, we actually, our peak and our where we started on that epidemic curve, we call it, so we started seeing cases quite late. So I remember kind of keep on checking daily our numbers of cases, and we didn't see them for quite a while. So places like London got hit quite early. So it took a while for the disease to get here, but then we did experience, we were quite hard hit. Looking at deaths, So again, I've just said the Office for National Statistics actually publishes weekly mortality reports, and it took a little while for them to start filtering through. The latest report that shows that up to the 24th of April, there'd been 123 Knowsley residents who died from COVID-19. The majority of them were in hospital, around 30 were in our care homes. And actually our death rate, so again, that's how we can compare ourselves to different areas with different sizes of population, and was actually the second lowest in the Liverpool City region, but it was above that of England, but lower than the Northwest. Some of that might be due to the low numbers and how small our population is. It does things to some of that data. But again, there's a huge caveat around this, and again, I'll come on to that in a minute, that this is underreported deaths. You know, we lost a significant number of people, or have lost a significant number of people up until that date. So we've started to look at deaths, and it's really important that we use another way of analysing deaths from COVID, because we recognise, as I've said, that actually some people will die with COVID and not get tested. So we need to find some way of picking them up. And another thing is that actually there's been concerns, and again, I'm sure you've heard this nationally, that we may be seeing excess deaths for other reasons, and some of the side effects almost of what the population has been through, and some of the messages and some of the changes perhaps to accessing health services may have actually had an impact on people. So if you think about it, you know, again, the population really was pushed that the NHS was needed to be protected, and what we don't know is whether actually the population took that on, that they shouldn't attend the NHS if there's something wrong with them, and that wasn't the message, but we do fear that some of that may have happened in our population. So when we look at those excess deaths, we need to consider actually, is there something of that going on, but also the fact that people will have died from COVID and not have got those tests. So I've just put there, just, you know, that those the greed, the other causes, and actually you can see that in some of those weeks we actually saw more deaths than would be expected, looking at the average. So we estimate that actually there's been around, so if we think of COVID, 123 deaths, we think that there's been about 133 excess deaths in general. So there's another 10 that can't really be explained at the moment. But again, this data is old. We need to see more data coming through, and we need to look behind those figures a little bit more. But it's just something to think about the effects. Now, moving on to care homes, we recognise obviously that they are an incredibly vulnerable cohort. So we know that COVID has much more serious impact on particular people who are in older age groups, and people who have other illnesses, long-term conditions, etc. And we also know that care homes are particularly vulnerable because they're institutions, and that you know, sometimes infectious diseases can within them. And we'll come on later in the agenda to the amount of activity that we've actually and the amount of work that we've done with our care homes, and our care homes themselves have done themselves to try and stop this. But again, as you can see, so this is the numbers of positive cases. Again, we were hit quite early on, but luckily we're starting to see that really taper down. So our care homes have been a concern and will continue to be a concern, but at the moment, touching wood, we feel that that things are under control there. I've just put a couple of slides, or a slide on just the response. So COVID was declared a major incident again quite early on, and that meant that the Merseyside Resilience Forum, which is a local resilience forum, an LRF, a multi-agency emergency response structure that sits within the command and control structure from COBRA, was formed, and that has a strategic coordinating group, a tactical coordinating group, and a multitude of support cells that have done a lot of the cross-borough work and cross-partnership work. I mean, it's got representation in it from local authorities, police, military, the NHS, a number of different partners, and it really, really helps to respond and to do some of that multi-agency work. And so there's been a number of cells formed looking at a multitude of different issues, such as PPE, such as testing, communications, management, transport, emergency services, how we protect the shielded population, how we're utilising the voluntary sector, and how we're protecting those vulnerable groups, and social care is in there too. At a local level, we've got similar structure. So we've got a strategic coordinating group and a tactical coordinating group, and then supported by operational coordinated groups, mainly mirroring our departmental structures. So again, that's really helped enable us to coordinate that response. So my final two slides, and I know I'm rushing through this, but I only have 10 minutes. My final two slides are on kind of some elements of next steps, and I won't call this recovery because for me it's how we're going to move into more of a containment phase for COVID. So one of the best evidence-based interventions around COVID and a number of infectious diseases is actually test and contact tracing. So that's a mechanism where you identify cases of the disease, and actually you then identify those people who've been in close contact with the disease and take public health interventions to prevent them from spreading it to others, because you've identified almost a real high risk cohort of people that are more likely to have the disease and pass it on. And if you think about COVID and the fact that actually you might be carrying it and passing it on with no symptoms, this is a really excellent way of doing that. So you're identifying people at high risk, and what we're doing with them is asking them to self-isolate for 14 days. So you take them through that potentially infectious period where they can't pass it on anymore, so we can't get back into that exponential growth. So there's a national test and trace service that started on the 28th of May, and people will contact that when they have symptoms. They will have a test arranged, and then if there's a positive test, they will then go through either a web-based program or an interview-based program where they'll start to identify those people who they've been in close contact with just a few days prior to them having symptoms and since they've been symptomatic. Those people will then be contacted, and again, as I've said, asked to self-isolate for 14 days. If they develop symptoms, they'll be asked to get a test and test themselves for the disease. So we have a role in that moving forward, working with our colleagues in Public Health England. Most of the time, we won't be involved in most of the simple cases, but we get involved in what are known as complex cases. So a person may be complicated because of their occupation. They may be a healthcare worker working in a care home, because of the setting. There may be cases that happen in schools, or because of the particular attention that may bring to an area. And we will work, as we do all the time, with our colleagues to manage some of those where they have a local flavour. So we've been asked in June to develop what are called Outbreak Management plans. And there's a number of things that we need to do, and a number of things that we've actually done already. We're not starting from scratch here and you know, not only have we done this with COVID, but also we do this with other infectious disease. So we need to identify our high-risk settings and make sure that actually we're working with them to do all we can to prevent cases and outbreaks in those settings. And there's a multitude of those settings, so just list a few of them there. Things like care homes, schools, hostels, you know, houses of multiple occupancy, and some workplaces might be higher risk. We need plans to be able to mobilise testing to reach the people in those outbreaks, and we'll be given much more control over how that testing is directed. There's going to be access to a much greater data set, which will inform us of our local activity. So not only then can we react, but actually if we're starting to see hotspots of disease, we may be able to intervene. We may be able to go and check out whether, you know, there's any concerns, whether social distancing is being adhered to, things like that. So the data set, we've struggled all along with the amount of data that we have access to, or good data that we have access to. So some of that, because we're testing more people, and because there's going to be national data that comes down, we'll be able to utilise that more. We need to also think about surge capacity. So as you can imagine, outbreaks don't happen predictably, and they also don't happen, they're not usually evenly spread out. We tend to get clusters. So by definition, there may be times where we have low activity and low requirements to act, but then there may be times where actually we're seeing numerous outbreaks in a geographical area, and actually we need to be able to mobilise with our wider neighbours and colleagues to be able to react to that, and actually also support them when those things happen. There's a role for the council around continuing to support vulnerable people. So again, we'll come on in when partners do their work, but there will be people who, because they're being asked to self-isolate for 14 days, may well really struggle. So there's an offer that needs to be made by local authorities around that. And actually, it's not going to come as any surprise to anyone that what is required moving forward is absolutely enormous public buy-in for this. This programme relies on the public adhering to any requests to self-isolate, but also getting tested and you know, continuing to social distance and make sure that actually we're really minimising the numbers of contacts between people in our community. So there's a huge public ask here, and we really need to be working with the public moving forward on all of this. And there's a political element to this as well. You know, we need our politicians to again support this work. There may, and we've heard again about some of the decisions that might need to be made for disease control. We may actually need to, in time, make some of those local decisions. And again, we really need our political arm to be working with us on that. So I'm going to leave that there. I've probably taken up 10 minutes, and I am sorry. But I know that when we move on to the main bit of the agenda, we'll cover some of that work that's been done with our partners. And I just really wanted to just give everyone a bit of a background as to what's happened.
Okay, thanks very much for that, Sarah. I think that's a valuable and really helpful sort of context and setting the scene really for the items that follow. I've not got any hands raised at this point. We'll pick up lots of detail in the subsequent items, picking up those individual matters, but I've not got any hands raised that other colleagues want to contribute. So I'm proposing to move on unless anyone raises a hand very quickly on that, but we've got a question or a comment for Sarah. No, so if we formally note that presentation and contribution from Sarah, that was really helpful, and thanks again, Sarah, for doing that. And we move on to agenda item 3, which is examining partner response to COVID And we've got a series of contributions here. I'm proposing to move around each of the contributions in turn and then take the questions at the end, if that's okay, so we can then have a discussion in a more rounded sense at the end. So if it's okay, we'll start with Philip Thomas, who's going to give us a contribution on behalf of the CCG. Philip.
Thanks, Chair. I'll work on the basis that board colleagues have had the opportunity and taken that to read the paper that was circulated and just pick out some key highlights. As Sarah's alluded to, we've been dealing with a national emergency and a global incident. The NHS is at the forefront of that and has, as a consequence, been operating under command and control arrangements. The CCG implemented its business continuity plan and successfully transitioned its staff either to home working and being able to support the system where it can from people's own homes, but also really importantly redeploying staff into the health and care system, whether that's supporting discharges or prescribing in primary care, or a range of our staff have gone back into frontline clinical roles as well. The CCG organised itself around two particular areas: incident response, so those things that needed to be done as part of the CCG's responsibilities, and I'll cover those in more detail shortly, and business critical activities, so those things that are part of the CCG's business as usual, which were identified as essential to continue during this period of unprecedented issues in response to COVID. So moving on to incident response, the CCG had two core areas really, so leadership and support to general practice and wider system leadership and support. So starting with the leadership and support to general practice, as I'm sure the board members will be aware, general practice, 25 separate organisations, and CCGs were asked to provide leadership and support to those 25 organisations and to adapt quickly to new ways of working, collaborating in ways they haven't necessarily done previously, and ensuring that we can maintain access to services for people who need them, whether that's urgent or routine care, and whether COVID or non-COVID related. In order to support this, the CCG set up a primary care incident management team, and 3.1.3 sets out the details of who's part of that. So moving on, the report then goes on to talk about a national standard operating procedure for primary care, and the principles are set out in section 3.1.4 of the report, and that's about ensuring access to services where they are needed, and that's provided in a way that's as safe as possible for patients, for staff, and for the wider population. It goes on to talk about total triage, with all patient consultations being subject to an initial triage to get a sense of what the presenting need is from the patient and how that's best supported, and really strong message to do that through remote consultations where that's clinically appropriate, but also recognising that there's a really important place for face-to-face consultations, home visits, in order to meet those various needs. 3.1.9 talks about the primary care assessment services that have been established, one at Nutgrove Villa and one at St Chad's, and they cover the whole of Knowsley, albeit there's a small number of practices who aren't part of that, because within the national standard operating procedure there's a couple of options available. One is around zoning, where practices can identify different parts of their estate to say, well, that's for people who are exhibiting symptoms and this area is for somebody else. So some have gone down that route, whereas a lot of other practices are participating in the primary care assessment services. And in 3.1.9 there's the detail in terms of the types of patients and situations those services are set up for. In addition to that, where it's not for we're not talking about patients who have an unplanned care need plus mild symptoms or moderate symptoms, where in the clinician's opinion they would benefit from face-to-face assessment. Practices are providing the CCD with assurance about how they are meeting that full range of requirements for their patients, across visiting, supporting shielded patients, urgent and routine assessments for non-COVID conditions as well. Looking at the wider support to primary care beyond kind of reconfiguring some of the way the services are delivered, prescribing support to practices, so access to medication, supporting the rapid implementation of e-prescribing, supporting practices around medication reviews, ensuring that patients have got access to medication when they require it, and also ensuring that there's access to end-of-life drugs where that's necessary, and ensuring that's on a rapid basis. Coordination of personal protective equipment in 3.1.6, supporting general practice around that, and working with partners, escalating issues regarding availability as required. Then moving on to the wider system leadership and support, working with the broad range of health and care partners. Already talked about how we've been working with primary care, but also with mental health, community services, secondary care, and other health providers, plus the council and care providers. Bringing those different partners together to be able to look at a range of different issues, whether that's around testing, system resilience, discharge support, system management and coordination. The report goes on to provide some additional information around testing and the work that North West Boroughs have been doing with a local test site, and moving forward the implementation that's already begun of mass swabbing within care homes of residents and staff, the NHS support to care homes and multidisciplinary teams, ensuring that the best possible support is available to residents of care homes, given that they're some of our most vulnerable people, and ensuring that they've got access to devices that can take some basic observations and video consultations, etc. Supporting the system performance and discharge and wider support, CHD quality and commissioning staff working with acute discharge teams and social care colleagues, working across 7 days to be able to support that, and wider management and coordination, playing into lots of things that Sarah talked about earlier, and working with those partners I talked about to make sure that we're looking across the system, understanding what the issues are, and being able to work with those to be able to unblock them and ensure that where services are required, they're available. The report then goes on to briefly talk about the business critical activities, and that's more for information in terms of how the CCG has looked at its overarching roles and responsibilities, identified those things that it needs to continue following the guidance that's been issued nationally, with a particular focus on interim governance arrangements, revised management arrangements, and identification of those business critical activities, how we're going to implement, manage and monitor the performance of those.
Thanks very much, Philip. If you move on then to Knowsley County update, I think I've got Deb Loughlin on my list. I'm not sure whether Deb's doing that or another colleague is.
It's myself, it's Julie.
Over to you then, Julie. Thank you.
Okay, thanks, Chair. Again, Julie, following on from the similar vein that Philip's just gone through, this just gives you the highlights really of the Council's response to the crisis. So the paper outlines the high-level arrangements that are in place, but I think just to advise members of the Health and Wellbeing Board is that the response and recovery aspects of managing COVID will also be considered at scrutiny during 2021, during their plans for 2021. So just to, again, just the original planning approach, the Council's planning has followed obviously best practice in relation to the National Emergency Planning. And we've been very much linked into the Merseyside Resilience Forum. We've been contributing and supporting the cells that make up that forum. So there's been a lot of activity and a lot of discussion and a lot of sharing of best practice that's gone on in respect of the forum. So that's been useful. If we go back to the start of the crisis, I would say that one of the key elements of managing the crisis was the successful management of the execution of our business continuity plans. And I think we were fortunate then that quite a lot of work had gone on in respect of those business continuity plans prior to COVID. So we were able to provide in respect of managing the workforce and in respect of identifying those that were mission critical. We were very quick to respond regarding that. Obviously, the role of public health is quite critical with this pandemic, and I have to say, you know, our public health colleagues and the team there have worked tirelessly to provide that expert advice and support and guidance regarding, you know, how the system needs to respond and manage in respect of COVID. Moving on to 4.4, we've outlined our mission critical activity. I guess, again, and I think it's already been mentioned, very much the success of that has been around partnership working and around how the system works together, comes together and responds together to what the needs are of our residents. I think what we have obviously had to do in respect of a response to COVID is not just mission critical and some of our usual business, day-to-day business. We've always also had to step into the breach and provide different types of support. And I think some of those are highlighted in the paper. So just to pick out some of those really. I think the first one makes reference to the financial support that the Council has been offering, certainly to our residents. And an example of that is obviously the reduction in council tax. I think moving on to some of the more practical support, obviously there's national challenges regarding the provision of PPE, you know, the personal equipment. And again, the Council has stepped into the breach there and done an awful lot of work regarding acquiring additional PPE, not just for our own staff, but also we've ensured that our commissioned providers, where they've needed it, we've also provided additional PPE for them, and that's been available on a 24/7 basis and has been quite well received from obviously from providers. I think one of the biggest asks for the system was the development of the volunteer hub, and I have to say, you know, Knowsley Better Together really stepped up there because that was put into place within a matter of days. I think it served our population very well. I mean, we've had over 2,000 food parcels delivered from there. Again, phone lines have been available over a 7-day period to take calls from staff, from residents who have obviously been quite concerned and felt quite vulnerable over the past few weeks. I think, and I know Philip's already talked about the support to care homes, but again, this has been very much a joint approach between the Council, and a number of other providers who've come together to do everything possible to reduce infection rates in care homes, on the understanding that we are fully appreciative that some of our very vulnerable residents are in the care homes. In respect of our schools, we have to say our schools never closed, and they've continued to provide support to children who are deemed to be vulnerable, but also, and quite critically, to support the children whose parents are key workers. And again, that's about looking at how we've kept the system going since the pandemic has hit. I think the final comment
is really just the additional support that we've been given to businesses. Because again, if you look at Knowsley as a borough, Knowsley as a system, the impact on businesses has been significant and can't be underestimated really. And again, the financial support and the practical support, and if we're looking at just the finances alone, you're looking at just over 13 million that's been offered as support to our local businesses. That's just to highlight, as you can imagine, there's an awful lot going on in day and night really in respect of how the council's been responding to COVID. I suppose where we're at now, yes, we are looking to move to a recovery phase, but we're also mindful of the fact that we may well indeed see a second wave of COVID. So whilst we are looking forward to recovery, we're keeping a close eye on those infection rates, and obviously we'll be guided by public health in respect of where we might need to step back into the breach to ensure that we continue to protect our residents as best we can. I think that's probably it from me at the moment, Chair.
Okay, Julie. Well, I think if we just pause there for a moment, then, and open that up, is there any contributions, questions, queries from board members on those two major elements in terms of the CCG and Knowsley Council? If anyone wants to raise that, we'll pick up. There's no specific hands raised there. No. Okay. Well, if we move on then to the Healthwatch, and I think Mary or Paul is going to give us a brief update from their perspective.
Thanks, Chair. It's Paul Mavers of Healthwatch. I'll take the paper if that's okay.
Okay, Paul, thank you.
So it's the partner update found on page 21 of the reports pack, and what I'll try and do is just pull out some of the main points. So as you can imagine, a key feature of Healthwatch's normal day-to-day activities is that face-to-face capturing of patient experience and feedback in health venues, or run of focus groups or partnership board meetings or engagement activities across Knowsley. And very similar to what other partner organisations have reported, in line with advice from Healthwatch England and commissioners, etc. Those activities, along with our enter and view activities, have been paused since the beginning of March. It was really clear at that point that staying in touch with as many local community members as possible throughout this period and still it is vitally important. So that's how we've shaped how we've worked moving forward since March. As highlighted in the report, where possible, we've maintained our core functions such as a telephone-based signposting offer, and we've continued to receive calls from community members with themes which have ranged from right at the beginning, should I shield, where's my shielding letter, how do I access my prescriptions, through to my family members being admitted to hospital and I can't get in touch with them. It's fair to say that the responses across the health and social care system to the questions that Healthwatch have raised on behalf of the community has been really positive and swift. In many cases, we've also signposted people through to the Knowsley free phone number and the volunteer hub, which Julie mentioned a second ago. Another statutory function of a local health watch is to provide information and advice to the public about how to access services. So RE bulletins and daily blogs has been the main source of providing both encouragement and hopefully vital information to local people. And it's been shared widely across social media platforms. Thanks goes to public health and CCG colleagues for contributing to the blogs and the information shared. And this really is one of the key areas where we receive daily positive feedback from community members in terms of how it supported them with the information and advice and encouragement. It's also important to reflect on this is of course an online source of information, so there's not that can't be accessed by everybody. So we also tried to do as much as we can to telephone contact people, stay in touch with partnership board members, Knowsley Other People's Voice members, and we've also set up a telephone-based buddying project to help people stay in touch with each other and use the e-bulletin information to pass that on. Julie's referenced the volunteer hub that's been set up, and Knowsley Healthwatch staff members also moved across to support with the daily activities around that as local hub members for Kirby and Highton. And it's also important to continue to try and receive as much feedback from the community as possible. So we've gone live with a survey, and I can talk about that under item 6 on the agenda today. In terms of next steps, it's really important that we look at alternative means of engaging and using online routes to stay in touch with people and hear their feedback. So Zoom really is our weapon of choice at this point. And we're doing as much as we can to stay connected and reconnect with partnership boards and Healthwatch groups through these means. The Knowsley Engagement Forum is going to be leading on a focus group to try and explore what practical advice could be provided to support individuals to possibly start planning now in terms of their own personal recovery plans to help regain people's confidence and independence. I think that's everything for now, Chair, if that's okay.
Okay. Thanks very much, Paul. If we move on then to Knowsley Youth Mutual and Paul Ginsky.
Thank you. So, yes, we've our contribution was, I suppose, primarily been that we've founded Andrea, who's usually on this board meeting, across to the council, and another member of our staff, Rachel, who's been leading on the community response. So we've lost a couple of key members there from Knowsley Youth Mutual, but it's been quite I believe a success in putting them across. We were asked to mainly focus on the 100 most vulnerable young people in the borough. And so our youth workers have been doing gate meetings with them, so they go to the gate. Sometimes if they're really young people, they're dressed as superheroes. And I don't think this is happening anywhere else across the country. But it's a way of just checking on the young people and seeing their health, how they're dressed, and things like that. We've also been active in delivering food parcels and activity sets for families. There's especially for the young carers, we've been going out and supporting them. Sometimes the young carers can't get out and do any shopping, so we've been doing the shopping for that. In the coming weeks, we're going to focus more lockdown, just a bit on getting our detached workers out. So we've got a dozen detached workers who are going to be wearing high visibility tops, which say youth workers, and they'll have identity badges. They'll be wearing PPE when necessary, and they'll be going out into right across the borough. People will see them, just to offer some security. You know, there's been issues around young people, especially young males, just ignoring the lockdown, and so we'll be engaging with them and trying encouraging them to take it more to heart.
Okay, thanks very much, Paul. We're staying with young people in particular, move on to the Safeguarding Children Partnership, and I think Colette's going to contribute on that item.
Sorry, Chair, yeah, just unmuting my... Okay, just obviously I'm on behalf of the independent chair of Safeguarding Partnership, Audrey Williamson. So essentially, Audrey's obviously looked across the partnership to consider the response for children across the borough. Essentially, in summary, has been satisfied around the arrangements that have had to be made, and obviously very difficult circumstances. As you can see from the report, in terms of children's social care in particular, we've had a real focus on some of those real high-end and emergency provisions that we've needed to continue to facilitate. So, for example, the MASH and EBT, we've strengthened both of those right at the beginning of the crisis as it hit, and we've been able to facilitate meeting demands in all of those areas, whilst all of our staff have been working from home essentially. So a number of aspects have had to change in terms of how we have worked. So many of the aspects of our work that's been previously would have with children and their families have had to be done more remotely. That has obviously caused, I suppose, for workers to think more creatively about trying to gather information and make assessments about levels of risk in very different ways to how they have previously needed to do that. However, and I think as Audrey talks about, there have been some real positive aspects of, I suppose, being forward in very different ways. And what we're keen to do as we move to a sort of reset position is not lose those positive aspects of how we've done services. A small example when I've been talking to social work staff has been a bit of an old adage as a social worker, that when you were driving children between homes or out on activity, if they were actually sat next to you in a car, you would get far more out of them in terms of being able to share with their worries and their concerns. It wasn't quite sort of intense and focused, and actually we've seen that in the ways that we've been working with children differently. So, social workers have described, kids, I suppose, because they're far more relaxed, are just talking on the phone in the bedroom, actually being more engaged and certainly a feeling of being able to share and to glean more information about a child's sort of daily lived experience than maybe a more formal visit that took place for an hour or so, was sort of, a real direct conversation, as gave different outcomes. So certainly as we move towards a sort of recovery and reset stage, there are some real positive ways of working that we would want to maintain and think differently, because, as I say, it has really added to our understanding of some children's lives. The other aspects that Audrey wanted me to flag up in particular is just how we have been staying in touch as a partnership. So partnership working with, we've brought forward our core leadership meetings. We would normally only hold every 2 months. We're holding those every 3 weeks. And Audrey, as independent chair, wouldn't normally attend those. They're chaired by myself, and they're just with the key part of the CCG police. However, given the situation, Audrey has joined those meetings to be really part of understanding what's happening on the ground. And those meetings have essentially given each of the agencies an opportunity to summarise sort of concerns, issues, the types of work that is taking place. So, for example, we've scrutinised data which demonstrated that in terms of our referrals, whilst they have been extremely low, what we have seen when it has come through the door has been really significant issues that have often required have required a level 4 response, and sometimes that has involved court proceedings. We've also seen, and it's interesting to have heard Paul's summary from Youth Mutual, because what we've also seen is a higher proportion of teenagers in terms of sort of family dysfunction, struggling to engage at home, etc. And again, in terms of learning, that'll be something that we'll be taking forward in terms of the sort of permission services that we would want to, have in the future. So that sort of level of scrutiny that's been happening on a 3-weekly basis has been incredibly important. And as I say, it's involved each agency doing a summary to the group. We have our first partnership meeting as a full forum next week, and that'll be a remote hearing, just a remote meeting too. And we're hoping that proves successful, and obviously we will continue to meet in that way, and probably move back to a more frequent meeting based in terms of the fuller partnership. Very, very aware again, I know we've mentioned a number of times about the sort of reset and recovery, but fundamentally, as you know, safeguarding an area can't just lie with one single agency. It's absolutely got to be everybody's business. And in terms of the recovery and the reset, it will be absolutely critical. Timings of service getting back to normal or getting back to a different position are all absolutely in line. So, for example, you know, as schools go back, well, actually, it's about school health. Will they be on site? We need to make sure that they are, because we know to end up lots of issues with children when they do come back into school. And I think that it probably sums up, in essence, the highlights Audrey wanted to flag on behalf of the partnership. Happy to take any questions.
Okay, thanks, Colette. If we move on to the contribution from social housing providers, and then we'll have a broader discussion. And that's Amanda Newton's going to give us a brief update.
Yeah, thank you, Chair. So the paper that I am presenting today is delivered on behalf of the housing sector operating in Knowsley. I think it sets out that, you know, we recognise that housing is a key contributor to health and wellbeing, and this sets out how we responded to COVID alongside our partners during, and continuing to do through the pandemic. So I think one of the things to draw out initially, Chair, is that a lot of our services had to be stood down. A lot of our core services had to be stood down under the government restrictions. But what that enabled us to do was to redirect our resources into the areas that were directly around supporting the health and wellbeing of our communities. I think just to summarise what's in the report, in terms of core services, we very much focused on supporting people to stay at home because you know, that was the instruction, but also to stay safe at home. So continuing to focus on our core compliance, like gas servicing activity, but also supporting people to be safe in their home more generally. Many of our core services were paused, but what we did do was direct resources into things like money advice, compliance and safety. We focused very much working with the local authority on facilitating emergency lettings for those people who were either street homeless or were having to leave their homes due to other reasons, so household breakdown, etc. We also saw an increase and have seen an increase in low-level antisocial behaviour, so a lot of our resources have gone into facilitating the resolution of those issues. Similarly to others, we release resources to work alongside the volunteer hub, and I think one of our big areas of learning here is that the level of community resilience has been really, really strong, and that actually we've been a facilitator of that. There's a paper later on the agenda on mental wellbeing, and I think one of the things that we've seen is a really profound increase in mental health issues of the people who have been contacting us. Some of which because people have lost their livelihoods overnight, and some of which the lockdown has kind of enhanced some of the mental health issues that they were experiencing already. So there's been a concerted effort across all housing providers to focus on wellbeing and being really proactive with our customers and wider communities around making those outbound calls, checking on things like social isolation, and really deploying things that people need in the moment. Similarly, it's been quite tough for staff, and I'm sure it has across all partners, who have seen probably some of the most profound impacts on people in our communities. So we've been providing mental health and mental wellbeing support for our staff as well, and really signposting to partners around getting help for people in our communities. There's been some practical community investment around supporting things like food banks from across the city region and within Knowsley. And then I think the paper just really talks about, we recognise that even when we get through this peak and we start to see the lockdown restrictions lifted even more, as Sarah pointed out before, there is still a risk to be managed around a second peak and the resilience of our communities. So I think Colette also mentioned we need to not lose sight of the good things that have come out of this and the positive learning. So there's very much a focus on lessons learned and using that for good. That's probably all I wanted to say, Chair. Thank you.
Okay. Thanks very much, Amanda. I'll throw it open in a moment, but I think I missed Councillor Donnelly's hand before, so I really apologise for that, Sean. I don't know whether you still want to come in at this point and kick off that broader discussion, perhaps.
Yes, thank you, Chair. Can I first of all say thank you to all our partners for all the work that they've done during this crisis and supporting our communities. I think the officers and people who've presented the report have really undersold themselves about what they've actually done for our communities. It's quite clear that they've had to step up services and create new services within a matter of hours and days to support all our communities. And they've also had to deal with the shambles of this government announcing things at 5 o'clock on one night and not getting guidance or any information until 3-4 days later, which really impacted on our communities for asking for information or being told things on the daily briefing and not getting any information for local authorities. I think we're all proud of our communities. We've all stood on our doorstep every Thursday night and thanked all the key workers, and I really want to place on record my thanks to all the NHS staff, all our care home staff, also all our council staff who've worked tremendously hard over this period, all the shop workers and all the other individuals who've supported in our response. And I think it's just been picked up there by another colleague who has just said, the Knowsley best together. We've seen our communities really come together and support each other, and I really want to thank everyone in Knowsley and all our partners for everything they've done to support our communities, because it's been immense, just from neighbours knocking on each other's doors to make sure they're all right and doing the shopping. And I think, as I mentioned before, some of the officers and partners have really undersold themselves on what they've been doing over this period. And I just want to place that on record. And can I also place on record thanks to Merseyside Fire and Rescue Service, who've been going out and delivering prescriptions and medication to some of our most vulnerable members of the community. Thank you, Chair.
Thanks, Sean, for that. Thanks very much. We've got some other hands up. Mary, you wanted to go in, Mary Stradley?
Thanks, Chair. Thank you very much, and nice to see everybody. I just wanted to sort of, I must be one of the few in this group that are going through. I'm in the shielding group, so I haven't been outside since the 12th of March. And I found that really, really hard. My son lives in Hampshire, so I've had nobody to get my groceries for me. I didn't have a letter from the government to say I was in the shielding group, but my GP sent me a text just to confirm that I was. So that meant trying to get my shopping, I'd have to stay up till midnight to get a shopping slot. And that was about 3 weeks ahead. So obviously you don't know what you want 3 weeks ahead, so I had to work something out on there. The hub, the neighbourhood hub, were brilliant because they got in touch with me and brought me a meal. But I found, I had to say thank you, but no thank you, because I've got allergies, so I couldn't accept the food. I've had a lot of good friends and good colleagues who've been phoning me and seeing how I am. The information I've had from the government about coming out of the shielding thing, like going for a walk, I don't feel very safe with that at all. I went out the other day. I've been doing exercise as well. I've been in lockdown, so I've been keeping up with everything, keeping busy with Healthwatch as chair. I went out day before yesterday for my first walk since the 12th of March. Now, I'm quite active, as you very well know, but when I got back, I was absolutely exhausted. My legs felt like lead, so it just proves that I wasn't using all the muscles and everything else. But the thing I miss is like going down to see my son, my family and everything. But I do worry about the other older people like myself in shielding that haven't got the communications that I have and only a phone or what have you, and how much lonelier they must feel than I do. I've had quite a few wobbly days where it's been really, really hard, and quite a few emotional days. And it's hard to express how I really do feel. But I thought I had to say this because within our group here, that, you know, the Health and Wellbeing Board, apart from Vicky, I must be the only one who is a member of the community going through this. If that makes, I know you're all members of the community, but actually living through this. Now, when I get out of this, I don't know how my well-being is going to be, how my mental health is going to be. And it's going to be, and no one can tell me because nobody's been through this before. So it's going to be definitely an unknown. But I'd like, as Councillor Donnelly's just said, there's one thing, and I've written it down. I would like to say thank you to all the agencies in Knowsley that keeping our community safe, and the hard work they've put in, and a lot of the time going far and beyond what's being called of them. And I'm very proud and grateful for that help I've had. Thank you, Chair.
Thanks for that, Mary, and a really powerful contribution. And I think it represents a whole host of people who will be grappling with those issues right across the piece. And as we move to recovery, I think we'll need to look at all of those things through those phases. So thanks for a really powerful message, Mary. Any other contributions any colleagues want to make? Okay, well, before we move on, I think there's a few really powerful messages there, isn't there, that we'll come back to. But I suppose I'd throw something out to the other partner, the other trusts and other partners, whether there's anything from their side you want to contribute to, and also to the agencies and partners who've spoken. Is there any asks of this Health and Wellbeing Board specifically that something we could do to help build on the excellent and valuable work everyone's done to date? I don't know if anyone wants to pick that up. No? Sarah's on YouTube. Is that you wanting to come in now?
Did you just say Sarah? Just want to find me. Just realise where it is. I guess, you know, we've discussed about the new strategy, haven't we? And I think that it's absolutely more needed than ever, isn't it? And I think the trick for us is to ensure that actually our new health and wellbeing strategy really, really takes into account the impact and COVID and moving forward, those longer-term impacts, and really try to work together to try and mitigate some of them. Mary, if I could, I would give you a hug at this point. Mary, bless you. Thank you so much for actually bringing us all round to you know, we recognise the impact that this has had on individuals. But you know, actually showing us that is so powerful, and I really hope that we keep in mind as we develop the strategy moving forward and really make it work for Knowsley as much as we can. And I hope that I learn how to.
Okay, thanks. Julie, do you want to? No.
Thank you.
Yeah.
Thank you, Mary, for sharing that with us, because as people have already said, we should always come back to how our communities, how our individuals who live with our communities are feeling and how they are experiencing the current situation. And I think where that should take us to is that as a Health and Wellbeing Board, we definitely need to make sure that we are fully sighted and are listening to what our communities are saying. And I just wonder, I know one of our priorities will be mental health and wellbeing of our community, but you know, more so than before, I think we do need to make sure that we've got those key connections with our communities so that we hear from them firsthand, really, because they're going to be the experts, really, in respect of how we probably need to reshape our services, you know, to manage the fallout of COVID and beyond. So just to flag that, really, that the connection with our community, I think, is going to be something we need to revisit.
Thanks, Judy. Any other colleagues want to come in?
Chair, can I come in again? Councillor Donley.
Yes, you can.
Thanks, Chair. I think just for me, it's probably a broad question for the CCG, also for our other health partners. And we've said, and the national media has said, that the NHS is returning to normal now, but we've also got to start looking about how we encourage more people to start accessing the NHS to get their normal testing, their normal health appointments, their screenings, because during this period we have seen a lot lower levels of people accessing the NHS and GP surgeries and others, and it's about how we're going to make sure that we're getting people to start use the NHS again in a more effective way. So if I can throw that question to the NHS and partners.
Okay. Is there anyone wants to on our?
Yeah, thank you, Chair. Thank you, Councillor Donnelly. I will cover a little bit more of this in the item I do have towards the end of the agenda. It is quite an issue that we are dealing with. It's fair to say that I suppose the government message was highly effective in keeping people away from some of our services, and such that linking as well to Mary's very emotional and timely comments, I think there's been a lot of anxiety developed and an amount of fear that we now have to address together as partners, such that people do have confidence to come back into services, and that we can actually make sure that we do get out messages to the population who normally would present, for example, with perhaps changes to the body and that might have a 2-week referral. We are looking at that national campaign, but also looking at how the services, particularly within general practice, are organised to get that confidence level back, that people can be seen where they need to be. And we're going to look at communication. So I was talking to the Chief Executive Council only, I think on Tuesday, about the need for us to work very closely and using colleagues in the council and the communications and One Knowsley, Healthwatch, all of our community groups, engagement funds, to try and get those messages out and be clear in explaining to people how we have reorganised services. Now, it's also fair to say, and I know Dr. Price is in the meeting, that many practices are now reporting that they are seeing normal levels of activity. So it's a really important matter, and I know that colleagues in hospital trusts and so on are also looking at how they can re-establish elective care and surgery, operations and so on, as safe as possible via zoning and cohorting our communities, our patients. So it's a real important matter, because linking again to Sarah's earlier comments around looking at excess deaths and looking at direct and indirect impacts of this pandemic. So we are very much aware, and mental health is going to be a huge issue. I know we're about to go on to a mental health paper, but the direct consequences of this on people and their lives is going to be with us for quite some time.
Okay, thanks, Dan. I'm probably going to move on there if colleagues are okay with that. I'm just conscious of time and we have got some very significant items to pick up, and I wouldn't really want to sort of prolong the meeting even more than it is, notwithstanding the fact that these are really important items. I think just to summarise there, I mean, there's the picking up contributions from various colleagues, the way in which people, and I've used that in a very broad sense, have worked together through this process, whether it's at an organisational level, whether it's officers and colleagues in a professional level, or whether it's sort of superstars on our estates looking after vulnerable people within their communities and everything else. I think that camaraderie and community spirit is, for me, the shining light through this process that we need to keep hold of and I was going to try not to say new norm going forward, but it is very much a really positive element of that community spirit. So if we sort of capture those things and move on, we're asked to consider the response to COVID-19 by the health and wellbeing partners and to identify any implications locally and areas for further work. I'd probably suggest, if members of the board are okay, that we note the contributions made by partners and their employees to the COVID-19 response. We record our thanks for those contributions on behalf of the board, and then we flag up that the one specific item, I think, that we can say that we need to ensure that the emerging joint health and wellbeing strategy fully takes account of the matters coming out of this response. Are members of the board content to agree that and move forward?
Agreed, Chair.
Okay, thanks very much. If at that point we move on to item number 4, which is the Knowsley Health Protection Forum update, and that's over to you again, Sarah.
Okay, so I'll take it that members have read the paper. Just to remind us, the Protection Forum is a subgroup of the Health and Wellbeing Board and has the responsibility for oversight and assurance that there are robust plans and programmes in place to protect from threats to health. Obviously, COVID poses a huge threat to health, and there are a number of implications of COVID, and we've just discussed access to other health services that also sit in the health protection arena. So, like I say, I'll assume that you've read the report. Some of it covers some that we've already gone through. I guess the thing that we haven't covered yet is the impact on screening programmes, and that's just raised in 3.1 to 3.10 to 3.13. And just to highlight there that as part of their business continuity and response to COVID, some of our screening providers did cease providing screening. So NHS England Screening and NIMS are actually working with them on their recovery plans. So that's something that we obviously need to keep an eye on. And immunisations, similarly, we're waiting for some of the data to come round, but we know that anecdotally, routine immunisations may have been one of the things that people were not accessing, even though they were continued to be provided. So again, we need to be monitoring and making sure that any drop in immunisation rates our partners are responding to. I guess the only other thing to note, and Health and Wellbeing Board throughout the autumn period and into winter will be getting updates on the flu programme. So obviously the 2021 flu programme is going to have a number of challenges this year, and ourselves and the multitude of partners that we work with around flu, it really is a huge multi-agency programme. We'll again need to closely monitor what's going on there. There's a number of challenges with it, and we've got a population that we don't know what their perceptions of accessing health services will be. It's absolutely vital that that population gets their flu vaccine this year, as in every year, but actually this is another respiratory illness that poses a threat, and it's the last thing that we need on top of COVID as well. It may be presenting operational challenges in that it's highly likely we'll be having to socially distance at that point. Well, actually, how do you deliver a flu program that requires vaccination of large numbers of people in those circumstances? So huge challenges, and I just really want to flag it to the Health and Wellbeing Board. It's something that we need to be monitoring throughout that time period. And that's it from me, unless there's any questions. Obviously, the Health Protection Forum will continue to meet and continue to fit to the Health and Wellbeing Board.
Okay, thanks, Sarah. Are there any comments or contributions from colleagues on that item? No? Okay, well, we're asked to note the update from the Health Protection Forum regarding COVID and consider whether we're satisfied with the actions being taken and identify any specific actions to be addressed. I take it we're all happy to note the update. Yep, is that great? And that likewise we're happy to confirm our satisfaction with the action being undertaken. Is that okay, colleagues? Okay.
Great.
Thanks very much for that. We move on to agenda item number 5 then, which is the mental health and wellbeing in COVID-19, which is Richard Halford. Over to you, Rich. I think you're still on mute, Rich.
Is that okay? Can everyone hear me?
Yeah, sure.
Okay. Obviously, as illustrated by Mary, mental health and wellbeing is going to have a significant impact on our residents and our workforce. So I appreciate there's quite a long briefing, but I assume that that you've read through it. I felt it was really important for the board to get a full understanding of the current situation in terms of the impacts of COVID-19 on mental health and wellbeing, the positive work undertaken by health and wellbeing partners locally. The paper does mainly focus on the CCG and council activity and through its commission services, but I do recognise that the stuff that Amanda mentioned in terms of the work of the housing associations, the work of Healthwatch and the community groups' role that they play is also crucial and something that we need to capture moving forward. The paper also picks up on the current demands, actual and expressed, and also picks up on some areas of challenge moving forward in relation to COVID-19, both in terms of the direct and indirect impacts of mental health and wellbeing over the short, medium and long term. And as it's been alluded to by Diane as well, it's going to be key to recovery and cuts actually across every single part of the recovery plan, be it in terms of regeneration, housing, the works. It's not just about the health response, it needs to be everybody's business. So the paper's coming to you really because it's at this point it's really important to collectively prepare and think through as a health and wellbeing system and partnership how we're going to plan to mitigate against some of the impacts and plan for the future challenges. The expectation is that demands will be significant and particularly, as Diane mentioned, to enable people to gain the confidence to reintegrate into society, develop skills to improve their and families' well-being, and to provide appropriate services to support individuals and families most deeply affected, as referred to by Mary. Clearly, everyone's daily lives have been affected, but some people, due to their personal circumstances, job role and stage of life, will have been disproportionately affected. And some details of this are provided in 3 of the report. So the approach to addressing mental health and wellbeing needs moving forward needs to both take a universal and a targeted approach. And so section 4 of the report highlights some of the activity undertaken in utilising both of these approaches, highlighting some good practice. So obviously section 4.1 goes through what's been the general population, very much on the promotion of crisis lines, national resources, providing of local communications through our usual channels through the council and partners. Section 4.2 to 4.5 also identifies some of the excellent work that people have already mentioned so far on today's call, actually, around the work through supporting vulnerable people through the volunteer hub and contact centre, children, young people and workforce mental wellbeing support, and also picks up on some stuff that has been done with the council workforce and with care homes specifically. But I'm sure that many of the other partners on the board could give examples of how they've supported their employees as well. But this just picks up on some of those positives. If I draw your section 6 of the report, this provides an overview of how the specialist mental health services have responded, including the way local commission services have adapted both for children and adults' mental health, and also provides details on the current demands upon services. We thought that it was really important for the board to share this with the board, because surprisingly uptake and demand for services over the COVID period have been mixed, as described. So, for example, around adults, for secondary mental health services such as the psychological therapies, known commonly as IAPT, the referral rates to those remain relatively low during this period, despite a lot of heavy promotion locally through volunteer hubs, through council and NHS comms. However, this isn't the situation with adult social care mental health, where there's been a significant increase in demand for mental health act assessments, and also the significant waiting lists for services such as bereavement and loss through our listing here. Likewise for children, it's been a very similar pattern. So for our mental health specialist services, CAMS, again during the period the rates of referrals have been relatively low compared to usual. But then for other services such as the service that acts below that threshold, COOF, for 11 to 18-year-olds, there's been a significant increase in demand, already stretching a very well-used service. And picking up on a point that Colette mentioned in the safeguarding update, there's been a real difference in the types of issues raised by children and young people through that counselling support. So some more issues around family dysfunction and anxiety around integration, rather than some of the usual stuff that's obviously around exam pressures and things like that. So it's something to pick up moving forward. I'd like to just finish by pulling up some other key things to consider though. So although the mental health services demands are mixed, it's expected and likely that it will increase significantly over the coming weeks and months in terms of demand. Indeed, insight from what Amanda said earlier, actually, in terms of mental health expressed need in housing associations is high. Healthwatch Knowsley surveys identifying significant issues, and also through the volunteer hub. So there's certainly going to be some latent demand there. And obviously some services have had lower uptake than usual as well. So there's going to be a latent demand as well. In terms of, to finish then, section 7 of the report identifies some of the next steps and things that the board should consider moving forward. So some are about reviewing specialist mental health support provision in terms of capacity with partners. But more importantly, though, as well, is it's not just about clinical services. It's about making it everybody's business, community resilience, building on the good work of the housing associations, community groups through the volunteer, and also looking at the good citizenship. So I think Mary Ann mentioned examples of where the community have stepped up and are providing some of that support in terms of maybe phone calls or through making contacts with people or delivering of goods, and I think there's something to build on there. And also around use of technology and campaigns moving forward. So I think in the Healthwatch report they're going to mention about how it can be facilitated to continue to have groups, but face-to-face in terms of meeting, but can it be done virtually? That's a relatively quick overview. Welcome comments and feedback on the paper and the next steps. Thanks, Chair.
Thanks, Rich. If I can throw that open then, any colleagues want to make any contributions or raise any queries with Rich? Can I just say, Rich, I suppose, you know, it's been flagged up a few times, as you mentioned, about the importance of mental health going forward. And, you know, we can't underestimate the impact of the health crisis we're in at the moment, but also the economic tsunami that's about to hit as a consequence of the pandemic, which will have major impacts on people's mental health too. And then that's a key point which I know is being picked up, but I'll ask you to comment on. But I've also got Mary wants to come in and make a contribution.
Thank you, Chair. It mightn't be the right sort of thing to ask this question, but what worries me are the carers. I was wondering what we have in place to ease the burden that they have on themselves at the moment, because they must be really isolated, a lot of them. And I saw a lady, I think it was on Northwest Tonight, and her little respite day had gone and she was looking after her husband and she was at her wit's end. They asked her what would she do. She said, I'd like to go to Australia and stay there. So I'm thinking that must be going on within our own community. And I'm just wondering, what have we got in place, or what can we put in place that would help the carers particularly, because I think they must be feeling it quite a bit more than some of us. Thank you, Chair.
Do you want to come back on those points?
Yeah, sure. To pick up on it, I can answer both in one point, I suppose. So picking up on your point, Steve, I think, yes, connections with the community and understanding impact is really important. And I think over time, the response to mental health and wellbeing needs to be tailored to individual needs, which will have to flex over time. So it's recognised, for example, risk of job loss, homelessness risk may not happen for a few months, but when the government schemes start to reduce that increased risk. So I do think we need to pick up in terms of, and that sort of partly picks up on Mary's point as well, is we do need to look at each of the different vulnerable groups and have an impact assessment related to that linked to mental health and wellbeing. So what are the particular challenges, for example, of seekers or domestic abuse victims who are fleeing that situation, etc. So I think carers is just one of those groups where we do need to really think about what is the specific support we need. I don't know whether any other colleagues have got anything to add from that from a council perspective, but I think tailoring the responses and having a clear understanding from the community of what the key challenges are and the specific groups is going to be really crucial moving forward.
Okay, thanks, Rich. Is there any other contributions anyone wants to make?
Chair, can I come in, please?
You can, Sean, yes, of course.
Thanks. Just to answer Mary's question, we've worked with the Knowsley Carer Centre to make sure all carers are supported during this period, from individual calls to group sessions using technology, so they're not socially isolated. You know, in some cases with people who had challenging behaviour, who were supported by carers, the council and social services staff and day centre staff have been supporting them in ways, maybe just taking the individual out for some short exercise, things like that. So we have been trying our best to make sure we can support our carers as much as possible. It's just very difficult during this time to give them the same support that we would normally would. And I'm sure Julie might jump in there if I've missed anything off. Just a question for Richard, if that's okay, Chair, or one of the NHS providers. In the report, it does say there's been a low level of take-up on the crisis lines, even though it's been well publicised through partners and everything. Do we have any of the figures of how many people know if they've been accessing them phone lines at all? Thank you, Chair.
Does anyone want to pick up that access to begin with?
If I just answer, Richard, just if I answer just for clarity, the low uptake was for IAP services for the secondary mental, it's not necessarily for the crisis line, but that's sports. I'll pass on to the Northwest Boroughs colleague. Is that correct, Rebecca?
Yeah, so I'm unmuted, aren't I? The figures that we're seeing actually at the moment suggest that the crisis line is probably receiving on average around 6 calls per day. And obviously the crisis line is manned 24/7. And just for obviously board members' awareness, obviously should someone contact the crisis line, what they receive is a biopsychosocial assessment that is used then to inform any decision making really and the necessary signposting that individual might need. So the signposting might be into primary care, into secondary care, or into third sector, or what we may refer people to some of the national and local programmes around mental health and wellbeing. And obviously initially I think the uptake of the crisis line was, but we are now seeing the increase in the use of that line, and also we are seeing that the reasons why members of our community are contacting that line are becoming more crisis appropriate.
Thanks, Rebecca. Any other comments from any colleagues?
Can I just regarding carers?
Do you want to come in and talk to us? Julie, on to you, and then Dr.
Right, thank you. No, Mary, just to add to what Councillor Donnelly's outlined, in respect of supporting carers, at the start of the crisis, we were appreciative that it was going to be quite tough for some of our carers. And I guess there's been a sort of graduated response. So for those who needed it, there's been a low level response. So there's been telephone contact, they've known who they could contact should they need support. We've then kept one of our day centres open, and those who families who were identified as potentially being high risk of carer breakdown, their family members have still attended the daycare services. And then we have, during the crisis, we did actually open one of our respite units, and we have provided respite for a number of families, a small number, but a number of families where carers really did need that break, short-term break, to prevent carer breakdown. So we have been being responsive as possible, and we'll continue to approach it in that way, Mary.
Thank you. Dr. Post?
Thank you. I think just to come back, not really a question, but a comment about the reduced rates of referrals, particularly through to IAPT and the secondary care mental health. I think that's been a reflection of simply people not willing or wishing to access services full stop. And I think over the last 2 or 3 weeks in particular, we've seen, as Diane said earlier, quite a big increase in activity, certainly in primary care. And I think those referrals are starting to go up now. And to that end, I've asked Dr. Poole, who's our clinical mental health lead, who's meeting John Edwards next week, because I think we do recognise that over the next probably month or two, there is going to be a big increase in referrals. So we need to try and upstream on that and make sure that we get activity ramped up.
Okay, thank you. At that point, I'm going to look to move on unless there's anything anyone's got any.
Can I Eddie Connor, I've had my hand up for a while. Can I speak, Steve?
Yes, of course. Over to you, Eddie.
Thank you very much. I've listened to it all and it's really interesting, but my main concern is not so much the group that we already work with and we know how it works. My concern is what's coming down the line, the tsunami of problems when we lose the furloughing and all that, and we've got unemployment, debt, bad health coming to people who think they're comfortable at the moment and have never worked with us. I think we're going to be overrun with problems when this stops in October, November, whenever it is. Thank you very much, Steve.
Thanks, Eddie. I think that's a really valuable point in terms of not only the health side, but the economic consequences that's going to have on people. So if we look to move on at that point, that's okay. We're asked to note the impacts of COVID-19 on mental health and wellbeing, the current and expressed demand for health services, and the actions taken to mitigate the impacts locally, including how mental health services have adapted and the key challenges that exist in the short, medium and long term. I assume we're all content to agree that. We're also asked to identify and agree actions for collaborative action and address mental health and wellbeing. And probably the two issues that have come out there that we need to pick up, I think, is that we need to highlight the support needs for carers, and not to suggest it wasn't on the agenda, but it's been highlighted in this meeting, and we should certainly highlight that as an outcome from here, and to maximise the access to support services around mental health moving forward, so that we can make sure we meet the current demand, but also picking up Eddie's point, the future tsunami that's about to hit the economic side of things and the issues that creates. And then finally, I'd suggest we want to agree to reinforce the need for this work to be a major item of this board's work moving forward in terms of the health and wellbeing of Knowsley. Are we all happy to agree those proposals? I'm not seeing any disagreement. If we move forward on the basis.
Steve, sorry, it's Richard. I had my hand up, but I suppose one thing that I think's come up really strongly is the importance of public engagement and understanding. So I think it's probably worth adding that a specific request moving forward.
Okay, yes, I agree. Thanks very much for that, Rich. So notwithstanding the points we made on carers and access, that public engagement aspect is another key highlight moving forward. So if we add that, is the board content to agree those proposals? Thank you. We move on to item 6 then, which is the Healthwatch update. Is that Paul again?
Thanks, Chair. Yeah, so I'm referencing the Insight report, which is on page 51 of the pack. And hopefully, I think a lot of this speaks to an awful lot of the conversations that have taken place so far, and maybe the beginnings of some of the community engagements that we can use and then begin to build on this. So Healthwatch Knowsley, supported by the local Healthwatch network and Healthwatch England, has produced and distributed a survey for residents to complete, which focuses on people's health and well-being during the coronavirus pandemic. So that the survey has been open for a month, and we've received 337 responses so far, and there's a link in the papers to the survey so people could take a look at the questions. So this has been shared across social media, through the Knowsley News, through GP practices, through the partnership boards, and we're working with Knowsley Youth Mutual also to try and gain some further feedback from young people. Some of the key themes that are coming through are the very much the conversations that have taken place during this board this morning. So the experiences of changes in accessing health and social care services, the cancellation of tests, etc., planned surgeries, but the long-term impact of that, which picks up on Diane's point earlier and many of the other points made by partners around the table. As expected, the impact of loneliness, which again is something Mary's touched on, which is covered within Rich's paper, on people's mental health, features prominently within the responses to the survey. So on page 52 and 53, you see that 19.5% of the respondents considered there was no impact at this time on their well-being, but a further 60% felt that there was a slight or moderate impact, and then 20% felt there was a real significant impact on their mental health and well-being. So frequent references to anxiety, feeling stressed, fed up, distance from families and friends, all the themes we've discussed this morning really as a health and wellbeing board are there and coming through from community members. The survey asks about the support mechanisms that people have had in place, And again, referencing the points that have been made by the board around community spirit, an awful lot of people have said their main source of support has been friends and family and their local community, which is really encouraging. It's also followed by support provided by GP. So 46% of people said their GP have been a real source of support, and then 36% of people have referenced their pharmacy as a source of support. So again, some interesting themes coming through there. With regard to a question which links to care homes, respondents are reporting that a lack of contact, which is understandable, has affected the well-being of their loved ones. And although staff within the care home sector have done as much as they can really to encourage that contact with family members, the concern remains there about loss of mobility and distress caused by people being potentially confined to their own rooms. So there's a key theme coming out, which we have been able to raise within conversations with the quality assurance and standards subgroup and contribute to the planning to address that at this stage. There's some brief highlights of some comments within the report that's been provided, which really details how people are feeling at this point in time. And I hope this is an opportunity that we can build on in terms of these comments coming through. So the next steps and the intention really is to keep the survey live and understand how people are coping as government advice changes. We're also keen to contribute to a Cheshire and Merseyside-wide report, working closely in partnership with neighbouring Healthwatch organisations. But I think there's a lot of detail within the report, which may be a starting point for understanding how communities are feeling. But we really need to build on that moving forward, picking up on the points that others have made. Thanks, Chair.
Thanks very much, Paul. Again, any other colleagues want to, any queries or make any contribution to that? No? So,
can I come in?
You can, Vicky.
Thomas.
Yep.
So I just want to echo what other people have said about thanking our partners and our community for really stepping up. I've never seen, and I'm sure all of us haven't seen, the amount of work and effort that's gone in across partners and in communities. People just really working all hours and beyond, above and beyond. So I wanted to start with that, but I also wanted to echo some of the points that have already been made around mental health and loneliness, but ask a specific question. Some of the community members that I've been really lucky to be engaging with during this time are digitally excluded, and I know that that's been an issue for us. But I wanted to ask a question to see what are we doing about that, because I'm really worried about those people that are experiencing loneliness, have limited access to some of the information that's being shared, limited access to their friends in their communities. And that I've got some really personal stories about those, but I worry about the people that I don't know about.
Thanks, Vicky. Do you want to pick that item up? Or do you want to pick that up from how that fits into the work you've done, and now that'll be picked up going forward?
I think it's a case of really agreeing with Vicky's point there, Chair, and I think it's so important that we continue to do as much as we can to hear from those communities, so we can wrap the appropriate support around individuals at the right time.
Thanks, Paul. Any other colleagues want to contribute? No? Okay. Well, if we just reinforce that point, that as Vicky's sort of emphasised there, but lots of colleagues have made during the meeting, that the engagement with our communities going forward is going to be the way in which we make a success of this or not, and getting that right will be a really powerful approach. Getting that wrong will set us back no end in terms of achieving the outcomes that we want to do. So that work and that insight into how people are feeling is really important, and dealing obviously with segments of our communities in dealing with that. So I'm really grateful to Paul and Healthwatch for presenting that to us. I'll be happy to note that report and presentation from Paul? Okay, thanks very much, colleagues. Move on to item 7 then. And I think this is a really important item. I'm a relentless optimist in life, and sort of as difficult as things get, we always need to look to recovery and taking things forward in a really positive way. And I'm delighted Diane's joined us this morning, or just into the very nearly into the afternoon now, as she's the lead for the borough in terms of a partnership approach to recovery. And so, Dan, over to you. On mute, Diane.
I'm impatiently muting and unmuting all the time. It's quite interesting. So thank you very much, Chair, for the opportunity. And I'm going to try and gather a new skill, which is to share a presentation as we're going through this. But I would like to start by just saying the purpose of coming here today is to give an overview to the Health and Wellbeing Board around the aspects of the borough's recovery plan which apply particularly to this board. I want to just set out the approach that's been taken by all of the partners under the Knowsley Better Together and the 2030 banner, and actually seek some views as well from members of the board on some of the priority areas we've looked at. And it's really interesting to do this now because, of course, a lot of the conversation that's taken place this morning, as you rightly say, is very pertinent. So I am going to try now and share, and I will try to share content. And then somebody's going to have to tell me if it is working. So can you see the presentation now?
Not at the moment, no.
No. Oh dear, not done very well. I don't know if somebody can assist then. Richard, would you be able to share it or not? People have got it, haven't they?
Oh.
I think it says Councillor Donnelly's going to share. Thank you very much, Councillor Donnelly, if you can assist me with your technical knowledge there. I can't see, it's coming up now. So people, I'm sure all the board members will know that in Knowsley we have a Chief Officers group, which is comprised of the Chief Officers of the various partners in the borough, and includes many of the areas we've talked about today: fire and rescue, police, housing, Chamber of Commerce, ourselves within the healthcare council colleagues, and it's a really good group. Shares, you know, we do very good work working together, and we're very keen to drive forward the agenda in the borough, and particularly looking at 2030 in support of.
Sorry, if I can just interrupt for 1 second. I know Sean shared that. Have all colleagues got that on their screen? Can they see it? Because I've not got it on the screen, but all colleagues have had the presentation, so they have got it. I wouldn't want to hold you up, Diane, but just.
No, and I'm keen to get on with it. Let me just. Now I have lost it off mine, but anyway, I'll find it.
Colleagues, so if you want to press on, we have got the presentation.
Everybody's got that. I'm going to press on when I get it back up because I appear to have closed it down.
Richard's come to the rescue.
Thank goodness, Richard. I told you I was pretty rubbish at this type of thing. So I can move through. So basically, it's all under the umbrella of Knowsley Better Together and 2030. There are recovery principles that we've all agreed across all of the partners, as you can see there. We want to build on our experience and progress and with our response to this pandemic. We want to make sure we align it with all our wider strategic partnerships. We need to follow the fact we've got a Merseyside Resilience Forum with emergency planning. And we want to focus on the whole borough, every aspect, so lots of the things that members have raised today. We are going to use the Best Together approach, and we're going to be clear on where we've got short, medium and long term. recovery goals. And we're going to maintain that focus on Knowsley 2030 because it's really important we do that around improving the borough and reducing inequalities and so on. We need to be alert to any possibility of future waves, of course, so we need to be ready for that. And so that is the borough-wide view. And then if we move on to the next slide, thank you, Richard, then you can see the structure that we've got, and we've used the objectives of 2030. We focus on the objective that specifically relates to our areas of work. Knowsley is a place where people are active, healthy and have access to the support they need. And so I'm leading on behalf of the partnership this work stream. So we've met and discussed with a small group, and we've looked at our core objectives, and you can see in front of you we need to look at lessons learnt. We need to understand and respond to it and the impact of COVID on Knowsley and its communities, and we've been really clear about direct and indirect, and we'll see that as we move through. We want to be quite clear about what constitutes successful recovery and how that links into the other areas as well. We want to be sure that organisations can also recover, so we need to play our part as partners in how we achieve that. And then we want people to collectively work together. And one of the things for me, we've been doing some work on care homes, and it's fascinating. There's some fantastic work going on, without a doubt, really superb, but it tends to be organisational based. So that's something we've seen, and actually that's been a really good piece of work for bringing us together. So you can see there we're going to ensure that the planning and implementation remains agile, and that is so important. In all of the terrible few weeks that we've been through, and we know we've got more to go through with COVID, there are some opportunities, and there have been some examples, as we've heard today, of really fast-moving, excellent, agile change that's made a difference to people, and including in the community. So we must keep hold of that. So cross-cutting focus, we've got to reduce existing and/or new inequalities, and we've got to mitigate impacts, take advantage, as we say. Communication is something for me that's come out really, really strongly today. So we can communicate to or with people. We need to do this together. So listening to, Paul's presentation just a few minutes ago, that's something we can take forward in our work, and that's really, really important. And then we've got to provide that basis and understand. So we're about to go on to a priority slide, but before that, I want to be clear that one of the things we're not going to do is create new groups. If there are existing forums, we're going to work with those forums, and one such example is the Health Protection Forum and the flu campaign that we're going to have to work through. We know we've got a new COVID virus. That is a respiratory virus. We've got flu season, which will be on us before we know it. And people are anxious, and people, are a bit resistant to coming into healthcare settings, and we can understand why. But there's great innovation. There's been in some of our practices, they've been giving patients whilst the patient is in their car. So rather than the patients not have them, then we do that. Now, whether there's a concept we can develop of drive-through for flu vaccinations, which are done very rapidly, as we know, but they've got to be done safely. So we don't know. We're going to have to explore that and do that together and keep our minds open to the art of the possible for our population. So we talked earlier, and I just want to bring together some of the observations I've had. Young people, there's a massive impact on young people of this situation. It's massive for all of us, but for young people, it's really difficult. People, colleges, universities, sleep patterns being disrupted. The other thing, bereavement's been really different in this situation. People not able to see their loved one, or not able to have the funerals, and then in care homes, people not able to see their families and vice versa. So there's a lot of indirect impact on people's well-being, mental health and physical well-being. And to take Councillor Connor's point, we very clearly in our group said there will be an economic impact, and there will be things like unemployment, and the furlough that Councillor Connor was mentioning will impact on people's health and well-being. So this group, this work stream that we're going to be building and working through at pace, it takes all of that into account. And so we've all got to work together in it. So we have looked at some priorities that we believe sort of, if you will, jump out at us. And what I was looking for from the board members is to say, well, what do you think about those priorities? Are there any other ones that we're missing? It's not a full list, it's just the start of the 10 that we work through. And it is so important that we take the opportunity to build this as a knows and place-based approach and working together with all partners for our population, because that's exactly what we should be doing and what everybody deserves. So the priorities, as we can see, vulnerable people, and what we're looking at with vulnerable people, I think we mentioned domestic abuse, asylum seekers, and you know, various other groups within that. Mental health and wellbeing and learning disabilities. And you know, learning disabilities group is a group that's been disproportionately impacted on by COVID-19, along with our, you know, Black, Asian and minority ethnic groups, where you see that talking in the country. So we know those sort of areas are more impacted upon. Cancer, as we've said, a big issue for the borough, and the doctors are not seeing those patients coming through, and the referrals are dramatically reduced at the moment. So we need to work hard on that. Flu vaccination, which Sarah mentioned. So we've got a flu vaccination programme. How are we going to do that? We'll do that through the Health Protection Forum work, but how are we going to do that? Care homes, there's loads of work going on with the care homes, and there's some fantastic opportunities there, and we're involving pretty much everybody, the care home managers, lots of people involved in developing, you know, what we will see as an excellence model. So that, and then test, trace, isolate and support will result in, I'm sure, some outbreak management, as Sarah talked about earlier. That's what we've highlighted at the moment. I've rattled through that for obvious reasons of time and so on. But it's really just about what do people think about it now. We've just argued with the last point, the test, trace and isolate. We will need an expert group to be working on that, because as an expert group we'll need to be advising politicians who will be looking at decision making and specifically, you know, the leadership of the council. So we will make sure we do that. So I have rattled through that, Chair. People have had the presentation and could look at it. It's crucially important work, and it's also a great opportunity. And you know, it's this board will be a key oversight board for the work. Thank you.
Thanks very much for that, Diane. I think the joined up approach there is really positive, and I'm sure something that the board would be really supportive of. Can I throw that open then? Is there any colleagues want to ask a question? Mary?
Chair, my own worry is I've been cocooned for so long, and obviously going to be a lot longer by the way things are going. Will I be susceptible, or do you know about this, medical wise, will I be susceptible to any more illnesses that are going round, because I've been in this cocoon for so long in my own atmosphere? If I go out, would I be susceptible to any other things that are going round? That's one of my worries.
I'll pass that one to probably Sarah and Dr. Price, because they will be able to talk more on that clinical area. What is happening though, Mary, is that recognition of a need to really wrap support and care services around our shielded population. It is so difficult and so hard. I mean, to imagine even, you know, people talk about having 7 days isolation or 14 days quarantine and how awful and disruptive that is. Whereas yourself and others in the shielded group have had weeks of this. And it is really difficult. So we are now getting clear messages through the NHS channels that we must wrap around the shielded group. But for me, it's not just NHS that, it's broader, exactly what we've said all morning. So in terms of are you more susceptible, that's a clinical question I'll, as I say, hand to. So and anybody in your situation, it's not necessarily yourself personally, you're asking people in your situation. So I don't know if Dr. Price or Dr. McNulty wish to comment.
I'm sure Sarah's probably more expert than I am on these kind of matters, but certainly nationally, the perceived kind of wisdom is that there is actually very little community transmission of this virus. It's mainly in either close family contacts or healthcare settings or in care homes. There actually seems to be not a lot of evidence of community transmission. So I think the message that's coming out now, particularly to the shielded group, that they should at least start to get out is probably sensible. I don't know if Sarah's got any thoughts on that.
I mean, you know, we need to monitor disease rates, don't we, moving forward? And I think, Mary, you're talking about other illnesses, aren't you? So, you know, obviously it's really important to get your flu jab. And obviously it's really, really important to keep, for everybody to keep washing their hands, and that will reduce the numbers of other viruses and other illness relating. I think the most important thing though, and it really links to what we've discussed today about mental health, is that, you know, any stress makes up our resilience, our physical resilience drop. And so, you know, anything that can be done to improve mental health and well-being will also help our resistance to a number of diseases. And I guess the other thing that concerns me, and if you remember, God, back in the day, before all this, when we talked about the Public Health Annual Report that was around physical activity, you know, I think if we're going to look at a physical activity campaign, which is in that annual report, we need to really think about those different messages. I know that you said that even though you think you've been active at home, actually, you know, you were pretty wiped out by what sounds like quite a short walk. So I think moving forward, we really need to think about how we're going to increase levels of fitness, physically and mentally, within our population, and particularly those, you know, are potentially going to be much less mobile moving forward. So, you know, I think there's a lot to think about as we go on. We can't predict at the moment what's going to happen to community transmission as we release lockdown. Hopefully the test and trace and the outbreak management plan will help to keep that contained. That's kind of what we're relying on, along with everybody just really keeping up those key messages. You know, don't forget, you've got to wash your hands. I know it's really, really simple. Wash your hands, keep apart from people as much as you can. But obviously don't disconnect from people, because that's also really, really important for health.
Thanks, Sarah.
Could I jump in there, Chair?
Paul?
Yeah, can I just say, yeah, well, I think we're all worried about young people going forward. A lot of the reports are saying we can expect like a 25% increase in youth unemployment going forward, and that. I think we really need to play to our strengths. And one of the strengths in Knowsley is the young people are incredibly creative. We've been setting up sorts of TikTok challenges and videos and things. They are amazing, and I think we need to just, as we go forward, we'll build on our relationships and make sure that even after COVID, that the young people aren't marginalised and they feel appreciated. I think one of the big things about, say, when I think of mental health, I think of relationships. And when I listen to Mary, I think of relationships. And we need to think about how we can help our young people with like generational stuff, and about how our young people continue to be creative. Some of the young people are actually flourishing out of school. School doesn't necessarily work for them. This is working for them better, and they're really loving it. And you know, they're more anxious about going back to school. So we need to be thinking out of the box a little bit as we go forward. And I don't want to finish without sending some love to Mary.
Thanks, Paul. Any other colleagues? And I think, well, if I can just ask, I mean, I mentioned that joined up approach before is really, really positive, and we do need to pick up those links, because if you look at people with underlying health conditions are more at risk. People who are deprived are more likely to have underlying health conditions. The links economically and health-wise are just immense, aren't they, and complete. And I think I'm really well assured that joined up approach, by joining that all together, and you mentioned communication, that's a really positive message, and that's coming through from you and the Chief Officer's team, and I'm really grateful for that.
Thank you very much. And certainly I know we will all work really well together and really hard, and take the challenge and address it in the best way possible for Knowsley people.
Thank you. Thanks, Diane.
Steve, could I just ask? Sorry.
Well, by the way, Vicky.
I wanted to pick up on Diane's points about working together across the system, and something that Rich mentioned about impact assessments. I was really pleased to hear Diane in particular talking about some of our communities that didn't necessarily get a mention in some of the reports specifically, to make sure that we're really addressing all of our diverse communities in our response to this crisis. Is it possible, or is it something that's already happening, to have an equality impact assessment that's across the system?
We are currently carrying out an impact assessment, and that will be something that we need to do quite continuously as part of this work, because things will evolve. So we are doing that, and I don't know if anyone's on the club tells a little bit more detail, but that's what we're really looking at, looking at those inequalities and the impact of this on all of the various groups within the population.
Thanks, Dan. Okay, unless there's anyone else, any burning issues anyone else wants to raise. I'd like to thank Dan for the presentation. And yes, sorry.
Rich, there's a number of people with their hands up.
Oh, is that? I couldn't see anything.
Yeah, Eddie, Councillor Con.
So, some of my videos coming through for people. So, Eddie, did you want to come in?
Diane, it's an excellent report. It's an excellent report, Diane. The priorities, I think, are good. But I wanted to say about the 10 and isolate. As someone who watches it on television, I don't understand how it works, and I don't understand how we are going to do all that and still support all the people that we're trying to do at the moment. I think it's a very big job, and I know you've got a very difficult job with in doing the 10. It's just a comment, Steve. Thank you.
No, thanks, Eddie. I'm sorry I never picked that up. Do you want to come back on that? Anything you want to add on that?
I think that there's with the test and trace, that actually there are some really good examples of you can recruit people who might do the initial work, but actually using existing teams to do it as well. So teams who are used to tracing, contact tracing and so on. And obviously that capacity needs to build up. It's not where it should be at the moment, and I think we're all aware of that. But using teams such as like sexual health teams, TB teams, environmental health, areas of within our boroughs or anywhere else actually have a skill set and the contacts and the abilities to work through, actually do really well with it. And public health, that is something they are particularly good at and talented at. So that would be the aim, and hopefully, I think as Dr. Price said, we wouldn't see too many of those outbreaks if people can just remember the thing Sarah said, which is social distancing and hand washing does make a huge difference. So hopefully, if we can keep getting those messages out, use the expertise we've got already within the borough. And people talk about, we've just talked about young people and unemployment. There are opportunities potentially here for people as well, for different approaches and careers and so on. So we just have to work our way through and embrace that and use resources, think outside the box, as I keep saying. It's too easy to do what we've always done.
Okay. Are there any other comments? Some of the videos aren't showing up for me, so if anyone's trying to indicate, I can't see them at the moment. No.
At the Steve. Sarah. Oh no, she's put her hand down. Andy Price, Dr. Price has got his hand up. I don't know whether that's to be lowered.
Andy's shaking his head and said he hasn't.
I think that's it. I mean,
okay, thanks.
I think if I could, Chair, if anybody does want to send any comments, if they could do that, send them to me and Richard. That would be really helpful for us. You know, people think about this, think about the whole meeting and all of the conversations, and if there is anything that people want to share, we're more than happy to hear that, because we are absolutely committed to making a real success of this work.
Thanks, Darren.
And Steve, sorry, Richard, just in response to Vicky Hornby's comment, there is already a Knowsley Vulnerable Persons group and one at a Merseyside Resilience Forum level, and so impact assessments and recovery planning has been done for particular vulnerable groups, and the council and wider partnership impact assessments are being done. So you can be assured that there is work going on, but there's more that can be done, which myself and Diane will pick up moving forward.
Thanks, Rich. So on that basis then, noting the various points people have made and the fact that Diane and Richard would welcome further comments sort of sent through to them that they can factor into the discussions, I'll be happy to note the presentation and thank Diane and the Chief Officer's team for the work that in pulling all that together. Yeah.
Thank you.
Okay, thanks colleagues. That moves on to agenda item 8, any other business. I'm not aware of any, and we've covered a whole wide range of ground this morning as well, so it just leaves me to sort of wind up the meeting, and I firstly apologise for running over a little time-wise, but nevertheless, very, very important and key issues being discussed, and I was conscious not to overly focus on time and give all those issues a full airing. So I'd like to thank everyone for the attendance today, really. I'm taking time out on behalf of the board. I'd like to thank all the organisations contributing to the health and social care system in Knowsley, and as you said before, the individuals in those organisations for contributing to that, and everything everyone's done really in communities and in those organisations on behalf of the board to respond to this public health emergency that we're in. I think it's fair to say that everyone involved has been fantastic through the whole pandemic, and I'd like to finally finish by asking everyone to take care of themselves, the family, the friends, loved ones who may have been affected by the pandemic in our communities, and also continue to look out to those vulnerable people in our communities that everyone's done a fantastic effort to help and support. So thanks very much, and I'll close the meeting there. Thank you.
Thank you, Chair.
Thank you.